Hi, my name is Layla Raka and I am the founder of Project Purple. Project Purple started as my Gold Award project for Girl Scouts. My project started out as donating bags to the Epilepsy Monitoring Unit at Hackensack Hospital. The goal of my project was to destroy the stigma surrounding epilepsy and seizures and the people that suffer from them. I was diagnosed with epilepsy when I was in 3rd grade, so I was about 8 or 9 years old. I am now 18 years old. My epilepsy was firstly diagnosed as petit mal epilepsy. My seizures came in the form of eye rolling. I was told that there was a very small chance that my seizures and my epilepsy would remain even after I reached puberty. In 6th grade, when I was about 11 or 12 years old, I got the diagnosis of focal epilepsy. Focal epilepsy is more so seen in lifelong cases. I was told that my epilepsy would most likely last for the rest of my life. In the beginning, my petit mal epilepsy affected my entire brain, but when I was diagnosed as focal, it only affected part of my brain. In January of 2018, I had my first grand mal seizure. I woke up one morning and I had forgotten to take my morning medications. Normally this wouldn't be an issue as long as I remembered to take them at night. That night I forgot to take my night doses as well. I had a sleepover with friends and sat upstairs with them. In the morning when I woke up at around 10 a.m., I went into a full-blown epileptic episode. I began to shake and nearly suffocated with the air mattress I had been sleeping on. My friend was able to roll me off and put me on my side and perform correct first aid for me. She sent my other friend to go call for help and alert my mother. When I woke up, I was surrounded by paramedics, my friends, and my family. My friends had been obviously crying, and it was a very distressing moment. My first seizure lasted nearly 5 minutes, which is considered very dangerous and increases my risks for death. Many of what I experienced that day I do not have any recollection of, nor do I have recollection of the days leading up to my seizure. I suffered from rug burn on my face and parts of my body, and I had pulled a few muscles. It was the day before midterms in my sophomore year of high school. It was very stressful to go in the next day with rug burn everywhere and to sit down and take tests. Since I am now 18, almost 19, I have lived more of my life with epilepsy than without it. I don't really remember what my life was like before epilepsy, as it's now become a bigger part of my life. It's influenced me to go to college and become a nurse, and I am a first-year freshman student at Mount St. Mary College. It also encouraged me to do this project for my Gold Award, as I felt I had owed the epilepsy community and owed to give back to them. By raising awareness and sharing important information about the disorder, I hope that I can educate some people and help reduce the stigma that surrounds epilepsy and seizures. Epilepsy and seizures in the media are often seen as a very horrific thing and often leave a bad rep for epileptics. Many people assume that epileptics are not smart or that since they have seizures, their brain is damaged. While multiple untreated seizures can result in brain damage, it's not often likely. Epilepsy Foundation recommends putting a person into the recovery position after they have had a seizure. Throughout high school, I tried my best to always raise awareness for my disorder and educate my fellow classmates. I often helped lead discussions in our first aid unit during physical education with the help of another friend and epileptic. Often my projects always had to do with something for epilepsy, whether it was discovering if epilepsy was hereditary or not in my biology class, or doing a statistics project on the recurrence of epilepsy in each state. Many think that I go overboard with my awareness about epilepsy, but every person that I educate and allow to gain knowledge on this disorder is one more person that I feel comfortable with if I were to ever have a seizure around. If it weren't for the first aid unit in our physical education class in my high school, I do not believe I would be able to sit here today and speak to you all. The only reason my friend was aware of what to do for an epileptic episode was through that first aid class and through another experience she had. One procedure used to diagnose epilepsy is called an EEG, or electroencephalogram. During an EEG, a person has wires hooked up to their head at specific points. So normally a wire would be placed here, maybe two here, on the back of your neck, and on your heart, along with all over your scalp. These wires are used to detect spikes in brain activity and see if they are abnormal or not. Ambulatory EEGs are very different from regular EEGs, as you can actually get up and move around during your test. During a regular EEG, you are usually told to sit still and to lie on a bed. Oftentimes they will perform sleep-deprived EEGs where you will wake up at 3 a.m. and you must stay awake until 8 a.m. or whatever your appointment is, and then you are encouraged to sleep during your test to see if you are having seizures during your sleep. With an ambulatory EEG, you are often hooked up to the machine for over 24 hours, if not 36. While you are hooked up, you are allowed to move around, go about your normal life, and do whatever you would normally do. But often, because of the stigma surrounding epilepsy and the lack of education, it is often very embarrassing for epileptics to go around and about in their lives. I was often met with many stares when I walked out with my ambulatory EEG bag, as they weren't very sightly or fashionable, and they were very obviously medical equipment. So for my project, I decided to make bags that were both functional and stylish, so patients in the pediatric epilepsy monitoring unit didn't feel so bad about it and didn't feel so alienated. At the epilepsy monitoring unit in Hackensack Hospital, patients often had to carry around their EEG machines in pillowcases, as they weren't really supplied with reusable, sanitizable bags. In my project, I took vinyl material and created handmade bags that could be reusable. In the epilepsy monitoring unit, they have 8 beds, and I made 12 bags, 6 with snaps to convert them into bags for the pediatric infants and small children. In the epilepsy monitoring unit, they see patients from newborns to 26 years old. Epilepsy is the result of demonic possession. Epilepsy is not the result of demonic possession. It is a neurological disorder caused by abnormal activity in the brain. Epilepsy is contagious. Epilepsy is not contagious. It is, once again, a neurological disorder, and therefore it cannot be passed on through contact with another. You can swallow your tongue during a seizure. It is physically impossible to swallow one's own tongue. You can't die from epilepsy. Epilepsy is a very serious condition due to prolonged seizures. Many people die from asphyxiation during seizures, as well as many die from seizures during their sleep. Only kids get epilepsy. Epilepsy is almost as prevalent in kids as it is in those 65 years or older, but that does not mean that adults ranging between the age of 12 and 65 cannot have epilepsy. With today's medication, epilepsy is a largely solved problem. Unfortunately for many, their seizures are not controlled. Many people seem to believe that if you have one seizure, you have epilepsy. A person is diagnosed with epilepsy after having 2 seizures 24 hours apart unprovoked. People with epilepsy are mentally ill or emotionally unstable. Epilepsy is a neurological disorder. The definition of epilepsy is a neurological disorder marked by sudden recurrent episodes of sensory disturbance, loss of consciousness, or convulsions associated with abnormal electrical brain activity. Seizures hurt. The seizure itself does not hurt. The aftermath of it does. Many people that suffer grand mal seizures, where there is convulsions and shaking, often pull many muscles or can hit their head on objects around them. But the seizure itself does not hurt. Women with epilepsy can't or shouldn't get pregnant. While epilepsy doesn't normally affect a woman's ability to conceive or pose any health risks for the child, if one is taking anti-epileptic drugs, the statistics for birth defects are between 2% and 10%. People with epilepsy will pass it on to their kids. Kids of parents with some forms of epilepsy are at higher risk of developing it, but the risk is very low. Only some forms of epilepsy are hereditary. While you cannot swallow your tongue, you can bite it off. You should never restrain a person having a seizure. There are two kinds of seizures. The first kind of seizure is called generalized seizures, and it affects both hemispheres of the brain. The second type of seizures is called focal seizures, and they only affect one area of the brain. Generalized seizures are subgroup categorized as absent seizures, also known as petit mal, and they include rapid blinking, staring at space, and eye rolling. Tonic-clonic, which are known as grand mal seizures, whereas a person will cry out, lose consciousness, fall to the ground, or muscles jerk and convulse. Focal seizures are subcategorized into simple focal seizures, which affect small part of the brain, and they look like twitching and change in sensation. Another one is complex focal. A person might be confused or dazed, unable to respond to questions or directions up to a few minutes. Secondary generalized is another type, and it affects one part of the brain, then the entire. So it goes from focal to generalized.